So today we're going to do a physical assessment on a pediatric patient. So upon entering the room, we are going to provide the patient privacy, and then we're going to wash our hands and don gloves. So once we get into the room, we're going to introduce ourselves, and then we are going to verify the patient's identity using the patient's ID bracelet that will be on their wrist. And the patient will most likely have a guardian in the room with them, so we will also verify with the guardian the patient's name and date of birth, as well as who the guardian is and what their relationship is to the patient, just to make sure that they are allowed to be in the room with us. So upon reaching the bedside, we want to just look at their overall appearance. So do they look like they're in good health? Do they look like they're well nourished? Do they have any lacerations, bruises, swelling anywhere on their body that we can see outside, away from their clothing, whether it be on their face or extremities? We want to assess for symmetry in the extremities, and other than physical appearance, we also want to check their mental status. So are they happy, or are they scared or irritable, which could be normal to be in a new environment? What's their level of consciousness? And anything that would throw up a red flag, we would want to document. Are they making eye contact with us? How is their overall appearance? So once we get that documented, we can move on to the patient's head, and this is, I like to assess from top to bottom. So starting at their head, depending on their age, we want to assess their fontanelles, so their anterior and posterior fontanelles. So the anterior fontanelle is going to close around 12 to 18 months. The posterior fontanelle, which is in the back, is going to close around 2 to 4 months. So if our patient is younger than 2 to 4 months, it's going to have both of those fontanelles most likely are still going to be prevalent. So we want to assess and make sure that there's no bulging of those fontanelles, because this could mean excess fluid on the brain. If it's depleted or sunken in, it could mean dehydration. So we want to make sure we assess those. And we also just want to make sure, if they're older than 18 months, that those fontanelles are closing properly. Besides those, we want to assess the patient's hair distribution to make sure that it's even. We want to see if there's any bruising, swelling, lacerations, anything like that, and make sure we note it. Any tenderness upon touching any parts of their head, to make sure that we are really thorough with that portion of the assessment. So next, we want to check their eyes and make sure that they have symmetry. Our patient is symmetrical with his eyes. We want to assess perla. So are his pupils equal, round, and reactive to light? What's the size of them? Are the conjunctiva pink and moist? Is the sclera white? Next, we can move on to the patient's nose. So we want to make sure that the nostrils are not flaring. This could show signs of dyspnea. We want to make sure that the nostrils are symmetrical and they're both patent, so there's airways and no mucus. And with the ears, we want to make sure that they are symmetrical as well, that they are suitable for the patient's size and age. If they're low-lying ears, that could signify a underlying condition as well. We want to make sure there's no drainage, no redness, nothing like that that could indicate any type of infection going on. Whenever you're assessing the patient's ears, if they're below 3 years old, you're going to pull the pinna down and back. And if they're above 3, you're going to pull it up, below 3 years, down, and back. And then above 3 years is up and back. So then we can move on to the mouth. So we want to assess the patient's mouth. Depending on how old they are, we can use this time to assess their teeth to make sure that there's no signs of neglect, because that's also a part of our job, to make sure that the patient is receiving adequate hygiene. As well as we can make sure that their lips are moist and not dry, This could be signs of dehydration. We want to use a clean gloved finger to check the palate, make sure it has closed properly, that the uvula is midline, that the tongue is not white and dry. Could be signs of dehydration, and just making sure that all the mucous membranes are pink and moist. Next, we can move on down to the neck here. So this is where patients have a lot of lymph nodes going on. It's not uncommon to find small swollen lymph nodes in patients, especially if they've had any type of infection, like ear infection or anything going on. But we want to make sure that there's no masses or swelling or painful locations whenever we assess that. Aside from that, we want to check their carotid pulses. We want to make sure that those are nice and strong and in the proper range. So next we can move on down to their chest. So here we're going to just assess the physical appearance. We want to look to make sure that the patient, that their skin is, there's no redness, no bruising, no swelling. We can check their skin turgor using their collarbones if we need. But we're also going to listen to, we want to assess their respirations. So is their chest rising and falling equally? Are they showing any signs of respiratory distress, such as grunting, or like I mentioned before, nasal flaring, or even retractions? That's something we definitely want to note right away. We're going to take our stethoscope, which I don't have with me. We'll take our stethoscope and we're going to listen to their left and right lobes, their lungs, both in the front and the back. So the right lung has 3 lobes. So we're going to listen in a zigzag motion. Starting at the right lobe, we're going to listen to the top, and then the left lung, and then the right again, then the bottom lobe of the left lung, and then finally the bottom lobe of the right lung. We will also do this to the back as well, so we can, if you prefer at this point, we can ask the patient to roll over on their side or sit up, depending on how they are, and we can do the same thing. So we'll listen to both lobes on the left and all 3 lobes on the right going in a zigzag motion. So we can have, while we're back here, we can go ahead and assess for like any types of bruising or lacerations or anything on their back. Make sure that all that looks okay, that their skin looks okay. Nothing going on here that we need to note, no breakdown, nothing like that. Something else with children, usually in younger children like infants, if they're left on their back a lot, their head can actually kind of flatten. So that's something we might pay attention to when we have them back here, just kind of dependent on the situation. So we'll get the patient back on his back. Okay, so now we're going to move, we'll go on to the arms since we're already up here. So we're going to want to check and make sure that, first of all range of motion, nothing hurts the patient, both arms, no contractures, nothing's bothering them. We, of course, want to assess for symmetry, as I mentioned before. While we're here, we can listen to the apical pulse for 1 full minute. We can check capillary refills within their fingertips, make sure that it's less than 3 seconds. And then we can just make sure that the muscle tone, that any muscles in the patient's body overall, and that there's no tenderness, and that their strength overall is substantial for their age, that it's appropriate. Next, we can move on to the abdomen. So in the abdomen, we're going to just assess the overall appearance first. So is there anything that sticks out to us, like any type of swelling, masses, bulging locations, anything like that? We want to assess, depending on how old the patient is. Sometimes patients have hernias from their birth, so where their belly button is, we want to assess that. And then we're going to auscultate the bowel sounds. So you don't want to palpate before you auscultate, because that's just going to stir up bowel sounds. So we want to make sure that we auscultate first. So when we auscultate, we're going to go in a clockwise motion. We're going to start at the right lower quadrant, go up to the right upper quadrant, over to the left upper quadrant, and back down to the left lower quadrant to make a complete circle. We want to see if it's hypoactive, hyperactive, or if it's adequate for the patient. We're going to ask the patient, when's the last time you used the bathroom? Or when's the last time you urinated? Did it hurt? Did it burn? How much did you use, or how much pee did you have? How much poop did you have? Use common terms that they can understand depending on their age. If they're too young to really answer us, or they have other reasons why they can't answer us, we can ask the parent or the guardian. We want to also we want to see what the color, consistency, odor, and amount was for any type of stool that was passed or urine. Next, we can go on down to the genitalia. This is a little boy, so we're going to assess, make sure if he had a circumcision a while back, that's all. It should definitely be healed up. Sometimes people have it later in life. Assess and make sure there's no drainage, no redness, nothing that would alarm us in that area. We want to make sure that there's no odors, which you should be able to smell right away. And everything just looks clean and taken care of. You're going to take your gloves off at this point, wash your hands, and apply new gloves. So next we're going to go on down to the lower extremities. So we're going to check all of our pulses in the lower extremities. So you have your femoral pulses that you're going to want to check, your posterior tibialis, your popliteal pulses, and your distal pedal pulses, I think is the name of it. You want to check all of those pulses, make sure that they are all, there's no bounding pulses, no weak pulses, make sure there's no edema in the lower extremities, and you want to make sure that everything's a +2 in that normal range. So we're going to do range of motion as well in the legs to make sure that the patient doesn't have any muscle weakness or any pain upon moving any of his extremities. Make sure there's no contractures, nothing like that going on, because that can throw up a red flag for us. We want to make sure that the patient's legs don't have any like crazy lacerations or of course kids get bruises, but uncommon sites of bruises, anything like that. So other than pulses and edema, that should take care of the lower extremities. So a few things, just backtracking, make sure I didn't miss anything with the patient's respiratory. So if the patient were to be coughing or have any type of sputum, we're going to want to also check color, consistency, odor, and amount, so we can keep an eye on that. We want to ask the patient how they're feeling overall, what their appetite's been, if they've been able to eat, if they're holding down their food okay. Kind of help us keeping track of I&Os. Trying just to make sure we didn't forget anything. Capillary refills, mucous membranes, fontanelles, pulses, and I do think that's everything. Of course, we're going to listen to their heart sounds and their chest as well as other pulses to make sure that all sounds okay. We don't hear any murmurs, nothing like that going on, and just assess the patient's overall vitals. But upon leaving the room, we're going to want to ask the patient's guardian if they have any questions. And we want to make sure that while we're doing this, that we're explaining the procedure to them so that way they understand what we're assessing and what we're doing and how this will benefit their overall care. It's a stressful time whenever you have a child in a hospital, so you want to make sure that you're providing all comfort measures as possible. And that's with the guardian and the patient. So just making sure that they're comfortable, Make sure that you leave the bed rails up ×2, bed in lowest position, call out within reach for the patient and the guardian, and make sure that just the child is overall comfortable and that we can make it as easy as possible on them. And overall, I think that's all. Thank you.